Today I'm at the Texas Oncology appointment with Dr. Cline. It'll be my first time meeting her, recommended by the breast surgeon, and I had to do the dress down, and you wear these cape things, I guess to protect your modesty, although when they do the exam they just open them up. Pretty typical room. Just looking forward to having a conversation with her, seeing if we have good vibes, and getting the treatment plan in place and start the ball rolling. So, see how it goes. Hi guys, happy Memorial Day weekend. It feels weird to not be at a barbecue or at the lake, or having just a cookout pool day with everyone. But I hope that you all are enjoying yourselves, and I wanted to give you an update after I met with the oncologist, Dr. Cline. It's been 26 days since they first found the lump during my routine physical, and just 11 days since the diagnosis of invasive ductal carcinoma in my breast. Since then, I have been able to see a therapist. She's recommending I talk to her through the telemedicine weekly. Joined a great Facebook group called the Pink Ribbon Cowgirls for women under 45 who have been diagnosed with cancer as well, and have been trying to figure out some fertility options. So far, finding the one that works best for Chris and I and wants to put us first has been a little bit of a struggle. They all seem, or at least the one I've worked with so far, seems to be very profit driven. It's frustrating because definitely wasn't ready to make a decision this quickly. If you think about it, we were putting our lives on hold to be in the Peace Corps, and we're really going to be having these discussions 2 or 3 years from now. And they don't seem to be very empathetic, and it's going to be some tough decisions, and probably more information needed over the next couple days and weeks to decide what's best for Chris and I as a family. On top of uh, talking to the oncologist and the therapist, I thought going to the dentist last week was a good idea. I wanted to be a normal adult and stay on top of my dental health, and it was about as uncomfortable and fun as usual. So I don't think that helped, but I was definitely in a little bit of a mental funk last week. If you texted or called and I wasn't able to get back to you, just know that your messages are appreciated, and they're all felt, and just really, just really nice to get from you. Next week is very busy. Chris and I are going to have a kind of meet and greet telemedicine appointment with a fertility specialist. It's the one that I don't have good vibes about, but we need to get some questions answered regardless. Some therapy. I'm supposed to be seeing this therapist once a week. And then towards the tail end, a lot of things are happening. I'm going to have the breast MRI, and that'll be pretty close to home, so we don't have to travel as far. But they're doing it with like a coil so they can really get a good image of what's going on with the tumor. And then the next day is Josie's birthday, or 30th, but I will have to be at or in Austin from 1 p.m. to about 6 p.m. Doing the bone scan and CT scan. It involves fasting, like starting at 9 a.m. At 1 p.m., I get injected with a dye, and then I can leave for a couple hours. I can't eat or drink any food, but when I come back, they will do the CT scan, and then finish up with the bone scan. And the reason that takes such a long time is the dye has to be fully absorbed into your system. And what I was reading with the bone scan is the dye will collect in areas that cancer may be present, and so you got to let the full couple hours to really work through your system. Um, and then we have the follow-up appointment with Dr. Cline, the oncologist, the following week. I believe it's on Monday, and she will be reading the results to us. So that'll be a big day. Thoughts and prayers will really be appreciated, because that's the biggest hurdle we have right now, is finding out if cancer is anywhere else in my body. Um, and I'll also have some follow-up questions for her. She gave me a very comprehensive list at the appointment last week of our treatment plan, but a few of the information sheets were missing. But she gave me most of the printouts, and so I'll want to go over any other side effects and things that we need to be worried about and watching for. And then the second question I'll have for her is specifically about um, uh, the goserelin, Goserelin. It is to suppress ovarian function and preserve fertility. So that's the second option we have besides seeing a fertility specialist and getting eggs frozen, is to get this shot. And but what I was reading online is this goserelin, also known as Zoladex, is supposed to be for premenopausal women who have early stage hormone receptor negative breast cancer, and I'm triple positive. So I want to find out from her if this is still the right fit for us. If not, that means then the fertility specialist is our only option. And yeah, so there's been a lot of information coming in. Takes some time to process, and good days and bad days, really. So thanks again to everyone who's reached out, and I'll provide an update on how the scans go next week. Besides actually doing everything, it shouldn't be too hard of a week, but the following one will definitely be a hard one. So yeah, hope everyone's well, and we'll update you soon.